online training for UNISA, and we are very excited to have you on the platform. I'm going to switch on my camera that you can see me. I hope it's okay. My name is Lizette Leroux, and I will be the program director for tonight, but I'm also the program director for the Higher Health program. And we are very, very excited to have you here tonight. This is the second round of our wonderful peer educator program that we have run with Higher Health, which is our main partner in this program. And you will also meet Higher Health later on. And we work with two other very important teams who we will present to you. The one is the Office of the Dean of Students, who's also joining us tonight. And we're very excited about the wonderful support we get from our Dean of Students, Dr. Sepuka. And we work also with ADOF, which is the technical specialists that is also on the platform facilitating this for us. And without them, we cannot have this program. But later on, we will introduce all of the staff to you before we move on. Before I actually play you a video of what this peer educator program is, and thank you to Mr. Richard Wright that helped us to make this video. I will ask our Dean of Students just to do the official welcoming for us. Dr. Sepuka. Can I have an indication if Dr. Sepuka are on the platform yet? If he's not on the platform yet, I know they're very busy with meetings. We will move on, and then when he joins, we will continue to give him the official opening. If I can just ask Richard and or David just to play the peer educator program, because this really gives you a lot of background of the program and what's in store for you. If we can just have that video played. Thank you.
The Peer Education Program at the University of South Africa, or UNISA, in collaboration with Higher Health, is an inspiring initiative led by the Dean of Students, aimed at improving student wellness and community health awareness. Healthy and well-rounded students are crucial for a successful South Africa. UNISA, in collaboration with Higher Health, has made a significant investment in health education to ensure students and surrounding communities are supported. Through this program, we train peer educators who spread essential health information, reaching beyond the university into communities across the country. The Peer Education Program is a volunteer-driven initiative that empowers students to make a real difference in health and wellness. Our peer educators address vital areas including sexual and reproductive health, mental health, gender-based violence, substance abuse prevention, and diversity and inclusion for all students. These areas align with Higher Health's commitment to a holistic approach to student wellness. Our peer educators received comprehensive training from July 15 to the 19th, 2024. This training covered key topics such as understanding HIV, TB, and STIs, managing sexual health, addressing gender-based violence, supporting mental health, and preventing substance abuse. Each of these topics provides critical knowledge and resources that peer educators share in their outreach efforts. Let's talk numbers. We are thrilled to report that 2,854 students enrolled in this program, and out of those, 1,085 were active participants who successfully completed the training. These peer educators went on to reach over 16,000 community members, bringing health awareness and resources to communities that need them most. Our peer educators have been active in more than 40 communities across South Africa, from Centurion and Johannesburg in Gauteng to Bushbuckridge and Breyten in Mpumalanga, to many other towns and regions across the country. This broad reach shows the depth and commitment of our peer educators in bringing health education and support to diverse communities. In their roles, peer educators focused on 5 primary areas: HIV and sexual health, gender-based violence prevention, mental health awareness, substance abuse prevention, and support for gender diversity and disability inclusion. Each peer educator implemented initiatives targeting these areas, ensuring they met both individual and community health needs. We also maintained regular communication with our participants through SMS and email, ensuring they felt supported and informed at every step. The peer education program also served as a tremendous opportunity for skill development. Our peer educators honed their critical thinking and communication skills, grew in emotional intelligence and creativity, and built strong leadership and teamwork capabilities. They practiced presenting health topics, managing time effectively, and supporting each other in creating real-world impact. These skills not only benefit their future careers but also enrich their personal lives and empower them to be proactive health advocates. One of the most fulfilling aspects of this program is hearing the success stories of our peer educators. Many have shared how they've witnessed positive changes in their communities, whether through increased awareness of mental health resources, improved understanding of gender-based violence, or enhanced support for reproductive health. As with any large-scale initiative, we face challenges. The academic calendar, with exams and registration periods, impacted student availability. Data collection for monthly reports was also difficult due to different social media platforms lacking standardized data recording options. Another challenge was the limited return rate for risk screening tools, which we continue to address with more engaging follow-up strategies. These challenges have taught us valuable lessons, and we are implementing solutions to better support future program participants. In summary, the peer education program has had a significant impact on student wellness at UNISA and beyond. Through the dedication of our peer educators, we've reached thousands of students and community members, creating a lasting influence on public health awareness and personal empowerment. This program exemplifies the power of student-led health education, and we are excited to continue building on its success. Thank you to the Dean of Students at UNISA, Higher Health, and every peer educator for their commitment to improving health and wellness in our communities. This program's success is due to each of you, and we are grateful for your contributions. Thank you all for listening and for your support of the peer education program. Together, we are making a difference in the lives of students and communities across South Africa.
Thank you, Richard, and thank you so much for putting this together. Now, I cannot think that each and every peer educator today in this platform cannot feel extremely excited for the broad shoulders that they are walking on with our first cohort that was last year. Hence, we could produce this video. But it also gave you a brief overview of a number of areas that you will touch, and our higher health team will take you through it in the next coming days. But without wasting any further time, I'm pleased to ask our Dean of Students, who is a fantastic support for this program, and he's leading this program, Dr. Sepuka. Dr. Sepuka, the platform is yours. Thank you.
Thank you very much, Melisat. Good evening, colleagues from High Health, our colleagues from the University of South Africa, and also from the broader fraternity of higher education. I also wish to welcome colleagues that are going to be our peer educators for this duration of this award. I must hasten to indicate that the University of South Africa is indeed the African university shaping futures in the service of humanity. And when this was arrived at, it was purely because we requested and we required people like yourselves as peer educators to be our tentacles in shaping futures in the service of humanities. Because one of the things that we can't do, the university has got almost 10,000 staff members, and it currently registers just about 400,000 students. And therefore, not all of us can be able to do the kind of service that's required of us to do without tentacles as yourselves. And therefore, when we were welcoming you into this program, was saying, please assist the university to shape futures of some of the most, I must say, without any fear of contradiction, that we service some of the most marginalized persons in South Africa and the continent. And therefore, having you assisting us to do the kind of work that we're required to do, therefore enables us to even spread further. Now, one of the biggest challenges that South Africa and the continent faces is, amongst others, the issue of access to higher education, but also throughput rates. If you were to look at where South Africa stands and Africa stands with regards to throughput against the Asias, against the Americas, and so on, you get a sense that even though that we produce quality scholars, even though that we are providing quality education, our throughput does not become best because of, amongst others, the social ills that our continent continues to face. And therefore, as peer educators, one of your important roles is to deal with issues relating to how do we deal with the scourge of social issues outside that which the academic space is providing. We would know, for instance, and I must, Melizat, indicate to our peer educators and colleagues here now, that amongst the failed subjects in the university is English 1501, and namely in the law faculty, English 101. And one of the challenges that our students are saying is that, firstly, they do not read their emails from the university with regards to how the tutorial guides are saying and so on. And therefore, it's incumbent upon you, colleagues, to work with our students in order to ensure that the most primary and most basic thing that they do is to go to my UNISA, read the emails and so on. Secondly, and sadly, is that last year, I think we lost just about 3 students with regards to the pressure and so on that comes with studies. And therefore, our trust is in you, colleagues, to ensure that we continue to engage our students so that issues related to the pressure that comes with the studies do not overwhelm our students, so that all of them were able to take them through to the finishing line. I know that Higher Health has given us vast amounts of monies. I think UNISA currently has the most number of peer educators in the system. We're looking at 3,000 per year. And I think that this is most important. I also think that at one point or the other, besides us serving the 400,000 students that UNISA has, we may want to engage Melizat further, Higher Health, in order to ensure that the combatants that we have currently in the numbers that we're talking about are also able to assist other students in the higher education system throughout the country, because some of them might be working for might be at UNISA, however, might be having neighbors, etc., etc., that are not UNISA students, and therefore, how do we get this huge number of peer educators to not only assist UNISA, but also the system in general? And these are some of the things that I'm hoping that in our next proposal to Higher Health, we should be able to infuse in order for us to be indeed the African university shaping futures in the service of humanity, and not only in the service of students of UNISA, but the system and society in general. With those few words, colleagues, I wish to welcome you to the program and indicate that myself, Melizette, and the team will be working with you throughout the journey, and hopefully, and we pray and we're going to work with you in order to ensure that we provide the necessary support to all our students in the university and beyond time throughout the university system. Thank you very much, Lizette. And I wish to welcome all of you, our peer educators, and thank you, colleagues, for this session. Thank you very much.
Thank you, Doctor, and we will continue to engage with you, and thank you for the Dean of Students that you are, and also for the support you give. At this stage of the program, we're not going to take any questions or hands. We will also facilitate that through comments on the streaming channels as well as here on the platform. Because tonight is basically just the introduction. As we continue to introduce the training itself, and that will start from tomorrow, I think the engagements will open up. So thank you, Dr. Sepuka. Next on the program is for me to introduce the different teams working on this. And I'm going to start with the team in student development, and it is in student social development specifically. Memongope is our manager for student social development, and she's managing this program very hands-on and operationally so. So Memongope, if you can just introduce your colleagues, and then I will ask Mr. David Haberstad to introduce the colleagues from ADOF as well. Memongope.
Thank you so much, Meliro, and good evening to colleagues and good evening to the students, and welcome to Peer Educators Program for 2025. On the platform, we've got Pintias Nguna, who is our student health and wellness practitioner, and we also have Ndlovu, who is the engine of the student development and also for the program of the peer educator. And we also have Tinyeko Baloi, who is our accounts officer, also assisting us in the peer educators program. Thank you so much. Over to you.
Thank you. And during the training as well, you will also see them visually as they engage with them. And thank you, Memongope, for yourself and the team. In the Dean's office, we also have Memodise and Mr. Sukile as well, who's also supporting this program. And without them helping us and giving us the support, that will not happen. I will want to ask Mr. Haberstad just to introduce the ADOF team.
All right, good evening, everyone. I hope you guys are well. A bit of a cold day in Cape Town. So I'm David Haberstad. I'm based in Polokwane, but I'm a digital technologist with ADOF, and we're working on strategic projects that are funded by DIET. Then I'm also with Mr. Richard Wright. Richard, you can introduce yourself.
Good evening, everyone. So my name is Richard Wright. You probably, if you joined from some of our previous lessons, you probably met us already. We were with ADOF, and I'm also an educational technologist, and we run quite a few programs with you that's also open and free, such as AI and all of that to help you with your studies. And we, glad to be part of this program and to assist with the technical aspects. Thank you, everyone.
Thank you very, very much. Then I will also want to ask either Mr. Oziel or Ms. Stephanie to introduce the Higher Health team as well. Without you, this is not possible.
Thank you so much, Lizette. Good evening, colleagues. Tonight, I am alone. My name is Oziel Ndleje. I am a university program coordinator. Unfortunately, due to our commitment that came up this evening, Stephanie, she had to attend that emergence with our CEO. She's not going to be part of our session tonight. I'm going to be representing Higher Health as my task in terms of the peer education program. But moving forward, we'll have more Higher Health team members who will be part of our program in each and every day till Friday. Thank you so much, Lizette.
Thank you very, very much for that. Students and peer educators, you will know the people around, the teams, the different working streams has been introduced. I just want to state that we will not take questions now. You can put your comment in the box, in the comment box, and we will respond to it. From tomorrow, the sessions will be much more engaging. Tonight is just for setting out the ground rules and giving you a bit more information on an overview, which we started with. Next on the platform will be Mr. Oziel, just to give us an overview of the Higher Health program and how the peer educating program specifically slot into that. Mr. Oziel, the platform is yours again.
Thank you so much once again. Let me take this opportunity and welcome the 2025 peer educators of UNISA. Also again, appreciate the executive management of UNISA for taking this program seriously. And then I think the remarks that has been made by the Dean before me indicate that UNISA is committed to ensure that students who enroll or study in UNISA are well equipped with the knowledge and the information that will help them moving forward in their lifetime. I think it's important to acknowledge that today, as Lizette has indicated, it's just an introduction. And then the program that is going to be happening moving forward is going to be facilitated by Higher Health. I have introduced myself. Perhaps let me repeat again so that anyone who have missed should get a chance again to identify me. My name is Oziel Ndleje. I am a university program coordinator from Higher Health. I support all the 26 or public universities in South Africa with regard to the program implementation. The Dean spoke about the support that is provided by Higher Health in your university. So that's the support that we provide in all universities. And it is my responsibility within Higher Health to ensure that I provide a technical support to the universities as you implement a health and wellness program. And part of the program that is implemented is centered within the peer education model, which is our vehicle to ensure that students get access to information. Perhaps I have to mention that before I upload my presentation that I am going to present tonight, I have to mention that the nature of UNISA is well acknowledged and respected in terms of being a distance online learning model. And then as a higher health, we have to adapt from our actual or usual, rather, in-person interactive peer educators training into an online format, so we can still build your capacity on critical issues while respecting the nature of the learning environment that you are at as students. And then I think over the 5 days, we'll focus on topics which were mentioned earlier in the video. And then I like the video that you have prepared, colleagues. And then it's such a great, excellent video. It gives every aspect in terms of a program that is implemented. But the topics that will be covered throughout the week, these are topics that affect communities. When you go to workplace, and I know some of the students who are present here, they are already in the workplace, or you are still working toward to go to the workplace. And some of the issues that we'll be talking about are in the workplace. These issues are some of the issues that are within our society. And then what are these issues that I am referring to? The video that was played earlier did talk about these topics, and such as sexual reproductive health, gender-based violence, mental health, alcohol and drug abuse. So, and then for me, I just want to start by saying this is your space, UNISA students, peer educators, this is your space. So feel free to engage using a chat box throughout the week. The team from our side will take notes of your questions and comments throughout the sessions. And then perhaps many of you may already been familiar with higher health or have worked with higher health before. But tonight, I'm just going to give you a snapshot of the overview of who we are and what we do and why your role as a peer educator is important. Perhaps let's begin and then work on the higher health overview. I am going to upload the presentation here that I want you to follow me with. I hope is visible on your side, colleagues. Please indicate if it is.
Yes, it is.
Okay, that's great. That's much appreciated. I just want to make sure that is put in the right format for presentation before I engage on it. But you understand that my presentation is basically going to talk to what is higher health, a role within the higher education space. And then also I'm going to be talking about what is peer education as well. But before I get to that, and I think when we speak about what is higher health, the higher health is a health and wellness organization. We are representing the higher education, a department of higher education, rather. We work with all the 26 universities, over 50 TVET colleges that we work with, the CET, which is our community education and training centers. And then I think what is most important is that to note is that we work in all 9 provinces as higher health. That means we cover all the 52 districts in the country where there is a higher learning institution or a campus, whether it's in a Tibet, whether it's in a university or CET. And then the majority of young people that we reach in our institutions, we are looking at about 2.5 million of young people that we work with in the higher learning institutions. And the majority of those are at the age between 15 to 24. But also I have to mention that our work is informed by the survey and studies that are conducted in our country, because higher health is part of the collective movement, if I can call it that way, that sought to respond on matters that affect our country, such as HIV, TB, STIs, gender-based violence, which are the main key areas that our country is focusing on. And then there are studies that have been conducted that sought to suggest that we really need to put our effort in our higher learning institutions. The higher education sector, it becomes one of the sector of the country that is most affected when it comes to gender-based violence, when it comes to mental health, drug, alcohol abuse, and then also unplanned pregnancies is one of the issues that we find it being an issue that is not easily to deal with within the higher learning institutions. What does that mean? It means it is important for our students to have access to sexual and reproductive health services in their campuses. And then you'll understand, some of you, probably if you haven't been to the university and spend your 4 years on campus, you realize that when you study in the university at the campus level, where there are no health services provided by the campus, it means you have to go and access health services in the public facility. And then we know that our public facility are very much overwhelmed. And then it then adds more stress to the team that work in the facilities that managed by the government. So what does it mean? It means our role within the higher education space, by providing health services such as HIV testing, TB screening, STIs screening, and all other areas that speak to health and wellness. It then allows students to have easy access to these services on campus without going to the public facility for these services. Now, these are our key priorities that we are focusing on. I think I've already spoken about it in terms of our focus, that we are focusing on gender-based violence. We are focusing on mental health as an organization. We are dealing with social and reproductive health. Disability is one of our key areas. And then gender diversity is one of our key areas that we are focusing on to ensure that the LGBTQI+ community find a safe space in our campus. It will only take awareness, creating a safe space. It means we need to be educated, we need to be informed, we need to sensitize our student community to ensure that the right of sexuality, it is observed in our campuses. Hence, we also talk about LGBTQI+ community. And then civic and soft skills program is one of the program that has been adopted by Higher Health. Now, actually, we are being identified as an academic or organization when it comes to higher education by focusing on these areas. Perhaps one of the areas that I thought when I give you an overview of higher health, I should give you a picture of the institutions or the numbers that we are dealing with when we talk of universities. And then you can see universities spread the entire country. Each and every province has a campus or a university. And then the student population that we have to reach as higher health, and then it means it's such a huge number. This is a picture that only demonstrates the university community. I have not arranged the picture that talk to TVET and CET in this presentation. Now, I think what is important that perhaps also you could be expecting in this discussion, and then which I thought I should make sure that I give you a snapshot to it, is what is peer education. And then peer education, we know that it is a concept, and then it's a concept that is being tested in many platforms as an approach that is used to communicate or being a communication channel, whether you call it a methodology or a strategy, and then it becomes a strategy that is sought to accommodate those you are relating with. And then in English terms, we all know that when we talk of peers, we are referring to those we are equal in terms of our socialization. And then when we talk about peer education, in this case, that's what we are talking about. And then peer-to-peer model in higher education, we are talking to students who are working as volunteers, who are equipped with knowledge, who are inspired with the information that sought to help other peers, who understand the challenges of their peers, who understand how to engage with their peers. I can tell you right now, I am a married man, and then I am over 50 years old. Unfortunately, I could not switch on my camera because for some reason, my camera is not working, but I will make sure that our IT team work on it so that I can be able to switch on my camera so that you can identify the person speaking behind this presentation. But the point I'm trying to bring to your attention is that being a man over 50 and married, when I have to deal with young people at the age of 21, 22 at a university level, obviously I may have understanding, of issues of young people at the university space, or at the TVET space, or young people as being raised by their families. But the reality is that currently, I do not socialize with young people at that age, meaning that my language is completely different from that age group. So therefore, peer education in our higher learning institutions, it become a key vehicle that we have adopted as higher health, that for young people in our higher learning institutions, they can learn better about these issues when they engage one another. So because you socialize together as young people. But I think what is important for you as a peer educator who have joined this program from today, it is important that you understand your roles and responsibilities as a peer educator. And I just thought to give you a few of these key roles. And in one of these roles is that you are expected to share information. That is why you are part of this training, because you are going to be equipped, empowered with information. But this information that is going to be impacted to you, you are expected to transfer that knowledge, that information to others. And then also it is important that then sharing the information, transferring the knowledge to others, it also requires the skills. It also requires the attitude. It is important that it is a role that you need to carry and understand as a peer educator. Because as a peer educator, you should be that person who do not discriminate or judge other people, irrespective of their condition. So whether it's HIV, whether it's a mental health issue, actually, even if you can identify someone seem to be having a mental health condition, but it's not for you to make a diagnosis, because only a psychologist who can do that diagnosis. But for you, you need a skill how you then make sure that you support someone you suspect could be going through psychological matters. That is very important. Your attitude is a key. And in one of the role as well is having your positive attitude. You know, you become a role model, actually, okay? And then your health behavior as a peer educator, it becomes a key when you engage and represent your peers. But I have to say, when we talk about being a role model, you are not expected to be an angel because you are a peer educator. And then some of you in this session tonight, you have made few mistakes in your lives. And then some of those mistakes are your lessons. And then that's what we are talking about. We are saying your past, your challenges that you went through in your journey. There can be a success to somebody by learning from you. Okay? So when we say you are a role model, it does not necessarily mean that you are perfect, because there's no perfect person on earth. Okay? So it is important we understand what we mean when we talk about being a role model, being that person who demonstrates a healthy behavior. You know, by acknowledging who you are, acknowledging your past, it also works in providing a better knowledge to some people as well. And then I think another part which is important is being a supportive person as a peer educator. Be there to your peers, for your peers, rather. Support them, and then be a trustworthy person who can be there to listen to their issues. Be there to listen to their problems. Sometimes you are not there to give answers when your peers are having problems, but just to be there to listen. to be a vessel for someone to pour his problems and challenges. That is important. You are not a professional in terms of dealing with problems of people, but being there as an individual, so-called a peer educator, it makes a positive impact to an individual. I think another thing is very important. Your role as a peer educator, you serve as a referral agent, meaning that you are in a position to hold your peers' hands and then walk with them, take them to the right place where is needed. If you identify your peer who happen to be living with HIV, but not taking medication, it is the role that you can play as a peer educator to ensure that you save the life by taking your peer to that heart facility so that your peer will get the ARVs. I'm just making an example of the ARVs. It could be something else, okay? And then you are an advocate as a peer educator. You create an awareness. You make an awareness on issues of inequalities, the lack of services in our communities, you know, and then it doesn't end in our campuses. Okay, making sure that our students understand and then get resources that they require as they are on campus or even in the workplace. Now, to be just more specific as a peer education program, and then I think it's important to mention that the program, so-called peer education, is designed to reduce the risk in terms of the challenges that we are facing in our society. But it's important as peer educators that we are able to attend our peer educators training in order to be able to advocate our peers. That is very important. That is why we appreciate your presence tonight, because you are here to learn, you are here to be trained, you know, and then the information that you are going to learn this week is going to allow you to speak with confidence on some of the issues because you have attended the training. And then I think also one of the issues which is important is the coordination that form part of your activities as a peer educators in terms of the implementation of the program in your campuses. And then I think the key also that comes with your role as a peer educator is be a person who's able to facilitate workshops, discussions, dialogues. You know, we are living in a society that is so much believing in a dialogue, because being part of a dialogue, it is actually an exercise that's sought to acknowledge that we are living in the community or in the society as individuals who may have different beliefs or see things in different ways. Therefore, if we engage in a form of a dialogue, we'll be able to allow each and every person to express himself or herself and then be acknowledged. And then that is very important. And then it is important that as a peer educator, you acquire that skill in terms of facilitation. I can tell you I've been working in the community development before I joined the university space. And one thing that I enjoy when I do my work is a facilitation of a dialogue. Because when I facilitate a training or a dialogue, I learn to learn as well. Meaning that I do not participate or facilitate a dialogue from the knowledge that I have only, or just being an expert. I shy away from representing myself as an expert when I deal with some of the issues. As much as I've been involved in the HIV space over 20 years, but I can tell you, I am not an expert on HIV because the matter of HIV changes every day. When I'm in a dialogue, when I'm facilitating a dialogue, I get an opportunity to know how people think, how people view some of the issues. And that helped me to learn and be humble and then learn to respect people. And then I think also another issue which is important is being a supporting student to ensure that they are able to access health services in our campuses. Okay. And then the health and well-being of our students in our campuses is very critical. I can tell you, I've been in working in a university space for quite some time. You will find a student being working on campus more than a year, but still doesn't know where the campus health is, where the student counseling is. And then that's where you come in as a peer educator, because your role, as you play your role to refer student and to be an advocate for help, that's where you make sure that students get to know about these services. Where are they? Where can you find them in Pretoria campus, in Durban campus? Where can you find these services? Where do you find a psychologist? And why do you need a psychologist? And why is it important to visit a psychologist? And that's your role as a peer educator. And then we do what we call a first-in-first activations in our campuses. Normally a first-in-first activation is where our services are provided or working with our partners. And then it is your role as a peer educator also to support. Before I end my session, but I just want to give you a picture as well about how do we implement our model as higher health. Because by understanding this model, you are going to be able to find yourself, identify yourself in a higher health model. When we talk about primary level, where we talk about knowledge transfer, that's where you come in as a peer educator, peer-to-peer education initiative, through by engaging with your peer, one-on-one conversation, sharing information, giving out flyers, posters, distributing condoms to your peers, conducting dialogues, having discussions. You are transferring knowledge, the information to the peers. That's a model that we adopt in terms of our program. But it doesn't end there. There's what we call a secondary level, where now we are saying, by providing information, by conducting a dialogue as a peer educator or anyone else, whether it's a higher health person or whoever engaged in the higher learning institution, you are conducting your dialogue on gender-based violence. There is a possibility that while we are engaging on these issues of GBV, sexual harassment, you are triggering to some of your participants. Some of your participants can relate to some of the issues that you are talking about in the session. Someone could be in your session going through that situation. How does this information help that person who's going through the situation? It's no longer about the information to this person. It's about how do I get out from where I'm at? That's the situation. So when we talk about the practical learning, that's where we talk about a risk assessment, where you are able to provide a tool that will allow individuals who are part of your programs that you are doing in your campus to identify themselves on issues that are raised in that particular time. So through that tool, you'll be able to identify OZIL, because how OZIL has answered the questions that were presented in the questionnaire. And then by doing so, you then learn that OZIL, he's going through sexual harassment at home. OZIL is having a partner where the protection is not used. Okay, so now you are starting to understand what are the issues that OZIL is going through, you know, and then now you understand the risk that OZIL that is at while you conducted the session. Now, after learning that through the tool that we have provided to your peers or to the participants, is what we call a tertiary level. That's where you link a person to the services. You link your peer to the student counseling, because the matter is got to do with, it's a psychological matter. Okay, someone needs to get a treatment. You are referring someone to the clinic. Okay, it can be any issue. That's how we work. So our peer education model is a youth user-friendly model. Okay, is youth-centered, is student-centered, to ensure that peer educators are the one who drive the message to the peer educators when services are rendered on campus, when their organizations, Department of Health, come to campus to provide services. And then we want to make sure that the program is speak to students. Now, you see what is called a certificate of recognition. So this is what we normally give to the peer educators as a token of appreciation as Higher Health at the end of a program. So through the Health and Wellness Center team that is present here from UNISA, they will submit the list of students who have completed the program to us, and then we will then be able to produce this certificate, which can add value in your CV. It can add value in your workplace to say you know how to work in a space that's sought to promote care and support to other people. I can tell you the workplace is looking for those people. The workplace is looking for people who are sensitive enough when it comes to gender-based violence. Because I can tell you right now, and then is what I've been saying to many young people or students when I go around conduct a civic and soft skills program, that the qualification that you are going to obtain in your university is going to help you, definitely. There's no doubt that it's going to help you to unlock the doors for you to enter in the workplace. But the workplace, it requires the soft skills. And then the qualification that you may have, it may not come with those soft skills if you have not attended a program that's sought to empower you with those soft skills. So it is important that we acknowledge that, because it then helps you as you move forward, that you've got skills. And then I want to say that because you are here as peer educators, to say you are not wasting your time by being part of the peer education program. Actually, you are helping yourself with soft skills that will enhance your qualification when you graduate from UNISA. When you go to the workplace, you'll be proud of yourself. The workplace will welcome you with the soft skills that you are going to bring accompanying your qualification. With that being said, colleagues, I just want to thank you for taking your time and listen to me. Thank you so much. Over to you, Lizette.
Lizette, you're still muted.
Sorry, I was going on. Thank you, Oziel. I was so excited about the knowledge of that you portrayed tonight of what is a peer educator. But obviously during the training, we will go much in depth with that discussion. The training will unfold in basically tonight a brief introduction. Tomorrow the content training is starting. On Friday, we will do the practical implementation. How do you do practical implementation of this program? And we're very excited that this is a start for you. We're also discussing with Higher Health, and Oziel, you and Steph, thank you very much. What is the next steps that you can lead you in getting that certificate? Not only the attendance certificate that Oziel explained, but the NQ level certificate. But we will talk about that more in depth on Friday, that this is a first step and it can lead you to a qualification actually. And we believe in lifelong learning, and that you don't do this only for the sake of doing it now, but it can actually lead to much more for you. So thank you very much. Colleagues, we're going to be brief from now. Unfortunately, we cannot take questions. Please post your questions in the chat boxes and our team will respond. And I also keep a quite eye on what is the comments, that we can also regroup as a team, that we make sure that we'll address all of them for you to your level of satisfaction. Then we are going to be guided by some principles for the training, and I'm going to ask me Tebogo Mongope to actually just go through the guidelines for the training. Thereafter, Mr. Wright is going to take you briefly through a short training for the platforms, and then that will be the end of tonight. Thank you, Tebogo.
Thank you so much, Mayor Leroux, and my responsibility, my assignment for today is very short and straight to the point, which is also to give students the guidelines that will be guiding us through the training. So I think it's very important also to have that, so that we can have a productive and very successful training. So I'm going to read it through. And then the first one is that students are 100% responsible for their learning and input on their peer educator health and wellness. All students must attend 100% of the session from today, 14 July 2025, until 18 July 2025. The focus will be on the training only. No other related matters can be discussed or asked by participants in the comment section. Have fun while you are learning. Embrace a willingness to learn and grow, not only for your personal development, but also for the benefit of your peers or community. Be kind to yourself and others participating in the training. That is very important, that whatever that at the moment you are typing, it must not affect or impact on other students or disturb other students. That we need to be mindful that as much as we are here, some of the things that we say, they are very sensitive to others, and we don't want to engage on that. And we are here to learn and not to make jokes about other people. So it's very important to respect each other. And then all practical, be kind to yourself and other participants in the training, as I've said. All practical implementation requirements must be adhered to confidentiality. Engage in extensive reading to broaden your knowledge and expand your intellectual for your intellectual horizon. And if you need anything or any assistance, please don't hesitate to get in touch with us at studentsfirst@unisa.ac.za. Thank you, Meliru. Over to you.
Thank you. And as we go along, all these presentations will be made available on the platforms and on Adolph's website as well. What we also will do is, because we saw that last time and we learn from the challenges of our students, that we will also have a record of students that went through the recordings. Let's say there's a power outage in your area, and then you can also later on maybe hook into the website and you can listen to the recording and participate in that way. There is a record of all the people that will go to the Adolph site and also download the information and so on, and we will have a record of that. So please make sure that if you didn't get something in the presentation, go afterwards, go and learn, because sometimes you can listen 1 or 2 or 3 times to something, and every time that you're there, you learn more of it. But mostly, I want you to take the time out for yourself between tonight and tomorrow night, that you really embrace and congratulate yourself that you were putting up your hand and coming to the table for this experience. And it will be experience that will stay with you for the rest of your life. You will be a peer educator for the rest of your life, because you will have the skills not only while you study, not only to get that certificate, not only to do the practicals, but it's something that you can take with you forever. And you can impact whatever environment you are in moving forward. So congratulations that you put your hand up, that you enrolled. And as you listen to Oziel and the market of the student population, UNISA has more than 1/3 of all students. And the fact that you enrolled in this program makes you extremely important and special. You're not only a peer educator, you're a leader in your own right, in your own group, in your own study group, in your own community, and embrace your leadership, because you step forward. And we are so privileged that you step forward, and thank you so very much for that. Our last item on the agenda is Mr. Richard Wright, that will take you through how to navigate yourself in this time forward, from today and tomorrow, and how to access all the information. All the recordings, every word, everything will be made available to you. Richard, thank you.
Thank you, Program Director. So from tomorrow, there is still a few that needs to be added. The program is still running, but we have made it so that you can access it now already. So what you do is I'll post a link in the chat again, but it's the same links that's been emailed to you. So you just access the link and it will open up this page that's displayed over here. So we'll tell you self-enrollment, you need to log in, you create and continue. Now, very important here, you must log in with your MyLife email. So click on that you are a student currently, you click yes, and then you click on use my UNISA account. I saw there was a few people that were in the Blackboard learning management system last year. So remember, this is the UNISA platform. So you log in with your MyLife email and your my UNISA password. So always your current details that you use for accessing MyLife or my UNISA, this is exactly the same. So once you're on the course, you'll notice there is a lot of things not available. So we open it up as we go through the sections. So from tomorrow, you'll be able to access the introduction and welcoming. We will upload the video today as well so that you can watch it again, especially if you're experiencing any technical problems around the way. We will also make available the resources to you throughout the week as you cover the different topics. So please come and join every night. Do your best. I'll come just the day afterwards and work through the recordings and the resources that were made available on the site. Now, otherwise, you will notice this platform was quite the same as my UNISA. So remember, you can use this left navigation. So if it's closed, you just click on the buttons, open course index, and then you can easily skip to various sections. And as I mentioned, a lot of it is currently not available, but what you can do is, at the moment, just make sure that you are comfortable accessing the platform. And then from tomorrow, the resources and the recordings will start to be made available on this platform. Just very importantly, make sure that you use your MyLife email address, the MyUNISA password, your current one, to always sign into this platform. Thank you, Program Director.
Thank you so much, Richard, and thank you that you make it accessible and easy. And as we go along, we will also learn from your great skills and from David and the support you're giving us as well. Colleagues, I'm going to allow Memongope, because one of the things that we said was leadership is important, that you step into it, and putting your hand up is the first step. But Tebogo just want to also thank a student on the platform right now. Thank you, Tebogo.
Thank you so much, Meliru. I think she said, I think he or she said that I've already started with the volunteer of being a volunteer. So I want to acknowledge Huitsi Ona Untatile Liselecha. I hope I'm right. Well done. You have showed a leadership. You have started with it, and you are in the right platform of being a peer educator. Well done. Thank you.
Thank you for that. I'm going to give our team, Mr. Nkuna, also just a last word from you, Mr. Nkuna, who's our health and wellness specialist on the platform. Mr. Nkuna.
Thank you so much, Meliru and colleagues. Good evening, our peer educators. As mentioned, I'm Pintias Nkuna. Peer educators, it is important for us to learn to accommodate diversity. As colleagues mentioned earlier, whether a person has a medical condition or a disability, please let us learn to be inclusive so that we can learn from each other. Thank you so much.
Thank you, Mr. Nkuna, and thank you for bringing diversity into the space, because peer education walks hand in hand with diversity. Embrace it in yourself and embrace it in others. I also just want Ndlovu's voice on the platform. Sipiwe, if you can just say a few words.
Thank you, Lizette. I actually also wanted to mention that there was a hand. I don't know if the person has answered just before you called out my name. Anyway, good evening, everyone. I'd just like to say welcome to the program. I see most of you are very interactive, and this is just the right space for that. I wish you all the best and that you will enjoy the journey of becoming a peer educator and just advocating for social issues. Thank you so much.
Thank you. We're not going to take hands. I see Wandile's hand comes up often. Wandile, please, I saw you posted. Post again if we didn't get what you wanted to say, but we don't open up tonight for comments because we didn't give all the students the same opportunity, and equality is and equity is very important for us. But we've said that. Thank you very much. We see you tomorrow. Keep warm. Pat yourself on the back and say, I'm here. I'm going to make the difference and I will get the skills for it. Thank you, Higher Health. We appreciate you. Thank you.
Thank you. Bye.
Bye.
Thanks, everyone. Good evening. Bye.
Bye, 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 guys.